I'm just going to sneak in here. Perfect. Yeah, I'll go with the other side right now. I'm just going to put it on.
Hi, everybody. Welcome to our low back class, the do's and don'ts of low back pain. We'll just give people a few more minutes to log on and get settled in. So make sure you're comfortable and you've got some room to move. And if you want to grab a pen and paper to take some notes, you're welcome to do that. And if anybody has any questions, you can type them in the chat bar. We're happy to answer any questions that you guys have got. We'll just give another minute here for people to join, and then we'll get started. So if you need to grab a glass of water or use the bathroom, anything you need to do to take care of yourself, please take a moment to do that, and we will get started in about 1 minute. Oh, we got one person on the chat. Cheryl Scott, I have sent a question to the email. Okay. Was that from Tom? Was that the question from Tom? Oh, no, that's not the question from Tom. There's Cheryl. I am just going to copy that and paste it into the chat so that everybody can see the question here.
I do want to all enough of that one, yeah. So I do these two slides.
Yeah, and then I'm sorry.
Yeah, and then you go into those.
Okay, so we've got that question in there, and I'm going to type in one other question.
Actually, I'm just gonna, I can put it in front of me so I can
Okay,
my notes
they can
as
see your notes
well.
in front.
Okay, just going to put it in there, and we will get to all the questions. So we are happy to have the questions come in. Okay, so let's get going on the class. So welcome, everybody. It's a pleasure to have you join us for the do's and don'ts of low back pain. We really appreciate you spending the next hour with us. We're going to have a fun, interactive, and informative class. Tonight, we're going to dig deep into why your back hurts and what you can do about it. It is going to be an interactive class, so please ask questions in the chat box. We're going to have some polls, and we'll invite you to participate in the polls. If anyone is brave and wants to speak on the mic, we'll invite you to share. We're going to review some anatomy and some reasons why your back hurts. Most importantly, you're going to learn some amazing low back hacks to correct pain. We'll encourage you to stay with us until the end because we're going to have a special bonus for all of you for attending tonight. My name is Katie White. I'm the owner of Courtney Massage Therapy, and I've been practicing registered massage therapy for over 10 years. Where does the time go? I'm not sure. I'd like to introduce our other presenters. The first is Lily Wu. Lily has been a physiotherapist for 8 years. She has a practice in Vancouver, and she also does virtual appointments out of Courtney Massage Therapy. So welcome, Lily.
Thank you.
Our other presenter is Maya. Maya is going into her 3rd year of the kinesiology program at UBC, and she's currently working with Lily at her clinic. And since then, she's been inspired to become a physiotherapist under the mentorship of Lily. Hi, Maya.
Thank you. Hi.
I'm just going to hand the mic over to Maya. She's just going to go over some Zoom housekeeping with you.
Yeah, thanks, Katie. So we just have 2 really important housekeeping things to go over. So the first thing that we talked about is the chat. So the chat bar is just going to be found on your right, where you can ask all your questions and then put a lot of your responses to the questions and polls that we're going to ask. So feel free to use that and just make sure that it's put to everyone and the panelists so that when you have questions, the panelists like Katie, Lily, and I can answer them and make sure we're addressing them. The second thing is we will get a participant to go onto the mic, so make sure if you're unmuting yourself and if you're the brave participant who comes to join us, just in the left bottom hand corner, there's a mute button and you just press unmute and then you can feel free to speak. Yeah.
Awesome. Thanks, Maya. So I guess we'll get started. Are you gonna start us off, Lily?
Let's see. So I'm going to share a screen first. There we go. We're going to start off with some quick polls. So if everyone can just answer in our poll, we're going to start our poll on Zoom. Just give us a second. See if we can minister it. There. So you should be able to see my screen. What events and activities is your back pain preventing you from? So you can just put in as many of these choices as you can, and then we'll give you a minute to just click onto your screen.
I think in my practice, I think low back pain is probably one of the #1 reasons people seek out treatment.
Yes, yeah, we see, I would say majority of our patients are also low back pain as well. So, you know, when they first come in and see us, we usually ask them like, you know, what is their back pain preventing them from? So if everyone can just kind of put in their responses and then we'll be able to kind of run the poll.
We're at 72% of the participants have, we're at 90% have voted. We're just about there. One more person. Don't be shy. Okay, so I'm going to end the polling now.
Okay.
And share the results. And here we go. Wow, look at that. Extended sitting from computer work and driving, 70%. And yard and housework at 80%.
Especially at this time of the year. This is like the spring gardening season, so.
Especially this year, everyone's had some extra time to get out in their gardens and make them beautiful.
Mm-hmm. So we'll go on to the second poll. For our second poll, look at your.
Yeah. So our second poll here, we have, what is the most frustrating thing about your back pain? And feel free to respond to our poll again.
Yeah, it's amazing all the different ways low back can affect one's life, including their work, their relationships, their ability to sleep, and basically enjoy life. Because when your low back is sore, it's hard to get out and do all the things that you like to do.
Mm-hmm. And it can also have emotional impact. Like it can cause, you know, you to feel frustrated, you to feel like kind of depressed when you can't do the things that other people can do or what you used to be able to do. So
yeah, very limiting. So we've got 92% voted again. So I'll just end the polling and share the results.
Great.
Yeah, 58% prevention from daily activities. That's a lot. And 58% frustrated with no solution. Yeah. 17% constant, 17% impair sleep, 8% affects relationship, 33% affects ability to work. That's pretty big number for affecting the ability to work. 8% emotional impact and 8% other.
Okay.
Did
So,
you want to do the third poll now, Lily, or is that coming up later?
Sure, we'll do the third poll too. So the third poll is rate your current back pain on a scale from 0 to 10, 0 being absolutely no pain and 10 being the worst pain you've ever felt. And it's like you need to go to the hospital. That's 10 out of 10 pain. You can choose the number kind of approximately of, why don't we say like this week? So like your pain this week.
Yeah, I've had people show up at the clinic with 9s and 10s, and it was interesting to get them into the clinic and then back out off the table and into their car in some cases. It was, yeah.
Very severe to like, you know, calming the number down. So calming the intensity down. That's what we see quite often too. So usually after like, you know, the first treatment, we like do the initial treatment or the second treatment, and they feel like, you know, the intensity going down like 2 or 3 notches.
I'll just share the results here. And lucky for us, we don't have too many people in the upper ranges. Looks like the highest number is at 27% at level 3. So still an issue. Glad to see nobody is hitting 9s and 10s.
Yeah. Yeah, so like that's good. Okay. So
Just go back to your little. Yeah, there we go.
Okay. So we got this. Now we're going to kind of open the mic up and see which participant wants to share with us their experience with their lower back pain. So don't be shy. Just, you know, whoever wants to volunteer, just type in the chat and we will unmute you and just talk about your pain and kind of find out a little bit more. Anybody who wants to come on chat?
We've got Lori Kublik. So we'll just unmute Lori here. Hi, Lori. Oh, and then we just got to unmute her.
And Laura, if you have a microphone on your side, yeah, you can undo the little microphone so you can unmute yourself. Okay. See?
There we go. Hi, Lori.
Hi,
How are you?
I'm good, sort of. I've been gardening a fair bit the last 2 months, and I'm one of the ones who said it affects my work because I used to be a self-employed gardener, and I don't do that for work anymore because I got sick of being sore and tired all the time. So it's my lower curve of my back. A chiropractor also tells me I have a kind of a sideways S curve in my back to boot, which I don't think is directly related to how I garden, but my spine.
So there was no original injury. This is caused from repetitive strain from the nature of the work that you have done.
Yeah, repetitive bending over and lifting up things and leaning and putting all my body weight into my lower back and knees and thighs and reaching to grab weeds, stuff like that.
Yeah. And so you've actually changed careers now because of it.
Yeah.
Yeah.
But I still have a 0.26 acre yard that I garden in.
So recreationally, you still garden. Have you found anything that relieves the pain?
Cow-cat yoga sort of poses. Okay. And laying on the floor, but having my legs up on an ottoman where the calves are supported on the ottoman.
Mm-hmm. Yep. So then you're not putting any load through your back. That's quite common with kind of self-management technique. How long has this pain been going on for?
Off and on 10-ish years. But lately, just 6 weeks-ish.
Okay, so have you found
Good.
that recently, did you change anything that hasn't kind of gone worse in the last 6 weeks?
Well, it's worse in the last 6 weeks because I keep gardening at least an hour or 2 or 3 every day. Mostly, I don't often take a day off from it. um,
It's that constant kind of repetition and maybe like sustaining in one, bending down and doing like that sustained posture that can be aggravating the pain again.
yeah.
Okay, so we will definitely go over kind of some tips throughout the rest of the webinar. There's going to be some posture tips. There's going to be a little bit of kind of like knowledge base on how like the curve of your back works, a little bit of kind of like the anatomy of your body, and then we'll go share some key tips on some exercises that you can possibly do to relieve some of that pain. How does that sound?
Sounds good.
Okay.
Awesome. Thank you, Lori.
Thank you, Lori.
Thank you.
Okay. Do we have time for one more share, Lily?
No, not maybe we'll keep going, and then maybe at the end we can still have one more share when we have time at the end.
Okay, sounds good.
Okay, so Maya's gonna go over some anatomy of the back.
Okay, awesome. So here in the pictures that we've shown are your typical spine. So the main series of bones that are central to the body are known as the spine, backbone, or the vertebral column. So a lot of this area contains the bones, connective tissue, and the spinal cord, which is really, really beneficial or essential to how we function. And it supports the head, has the attachment points to the ribs, and has the pelvic girdle, and has the muscles in the back. And then it has 26 of the vertebrae. And in this area of the workshop, since we're focusing on the lower back, we're going to be looking into the last 5 lumbar vertebrae, as well as the sacrum and the coccyx, which is the lowest part of the spine. And it's the largest part, which is really beneficial for supporting our body weight, because all of our body weight is going to be supported by that lower part of the spine. So then some important features of the spine to note are basically the intervertebral discs. So there's some kind of cushiony discs right in between each vertebrae, and they're made of cartilage and then have an inner elastic substance that allow us to absorb shock. So when we're jumping or doing anything that has a lot of force, those intervertebral discs are going to absorb movements like rotating, bending, twisting, etc. And then the second part that we're looking into that's really important in our diagram here is the green area on the skeleton, which is also known as the pelvic girdle, or commonly known as the pelvis or the hips. So the pelvic girdle is made up of 2 hip bones, which are the ox coxa, and often referred to, or connected, to the sacrum. So the pelvic girdle has a lot of functionalities, like providing a sturdy base for the vertebral column, and then also protecting the lower abdominal organs, as well as a means to connecting the lower limbs to the axial skeleton, or like the middle portion of your body. So after the lower back anatomy, I'm just going to go into some lumbar spine injuries here. So the main action muscles of your back are going to be your paraspinals, or they're also called the erector spinae muscles. So they include 3 main muscles, which are going to be the spinalis, the longissimus, and the iliocostalis. So the main actions that they're producing is your bending in all directions, your rotation, your twisting, movements of the neck, and then control of your posture, which is really, really important, and we'll go into that later. So a common result of our back pain can actually stem from really, really stiff paraspinals. And that can be due to muscle atrophy, which is like a decrease in size of your paraspinals if you're not using them a lot. It can also be due to like sedentary behavior, and then strain of the paraspinals or really poor postures, which can weaken your paraspinals, like I mentioned earlier, and decrease. And then another common injury of the lower back includes degenerative changes like osteoarthritis, and they're mostly it's commonly found in like middle-aged or older individuals, and it's your most common form of arthritis. So the reason behind osteoarthritis is basically that cartilage that we talked about in the intervertebral discs, or like those squishy discs in between your vertebrae, basically wear down over time, and then the inner elastic component hardens, causing the space to become narrower. So then that cartilage is, those vertebrae are starting to rub against each other, causing a lot of pain. So then the last thing is that that osteoarthritis can trigger osteophytes, or also known as bone spurs. And bone spurs are the body's way of repairing itself when it detects inflammation. So when you're feeling that pain, the body's going to create these bone spurs. But it can cause pressure on the spinal nerves, and that's what's going to be causing all that numbness or tingling that's commonly found in hips or legs. So if that's a common symptom, this Lily's going to go into that later for you.
Yes. So I'm going to go over
Yeah.
nerves, as Maya kind of talked a bit more about the bone. So what the diagram here shows is kind of like where the different nerves run and kind of the patterns of the nerves. So nerves, they have two functions. So they have sensory functions and they have motor functions. So for sensory, some people, if they're getting a pinched nerve in their back, they may feel tingling, numbness, achiness, shooting pain, sharpness, heat. So those are kind of common like sensational feelings that the nerve might be irritated. But as the nerve gets more and more irritated, it will actually impose motor functions as well. So people might start feeling weak in certain areas that the nerve might go down to. So for example, in this picture, there's S1 and S2. So these two nerves, it kind of goes down to the rest of the leg. So it's part of the sciatic nerve. And then if this is impaired sciatic nerve, then people might get tightness in their hamstrings. They might feel weak in their hamstrings, or might feel weak in their calves. So this can be part of motor functions because the nerve has been impinged by different levels. So we'll go into kind of like different injury to the nerve and like what kind of conditions those might be. So for the next slide, as you can see in the first section, we talk about spinal disc herniation. I don't know if some people might call it like a slip disc, herniated disc. You might hear that, you know, through friends or, you know, like through the media. So what a spinal disc herniation means is when usually there's trauma. So like when someone's like maybe bending down and like bringing something heavy, they can actually, that force can cause that disc to squeeze out of its original position, and it's kind of like parts of it can be herniated, or like the full disc can actually come, that little circle here, the middle part can come out and then pinch into the nerve canal, which is like running in between that space. So when that happens, then, you know, that's the feelings that we were talking about earlier, the tingling, the numbness, or like kind of shooting pain, or like muscle weakness as well. So like
Lily, can I just interrupt you? Sorry. Are you able to make your slides bigger? We're just getting some comments in the chat that people would like the screens to be bigger so they can see what you're showing. Oh, perfect. Okay. Thank you. Thank you. Yeah, okay. That's perfect.
Okay, let me just minimize this so it's not in the way. Okay. So yeah, so this is where this is the middle part of the disc, and then the yellow part is the nerve. So when the disc kind of gets pushed out, it actually causes it to go into that space where it's supposed to be empty. You know how here between the bone and the disc, there's a narrow space where the nerve runs out. When with the disc herniation, the disc is actually causing that pressure onto the nerve. But with disc herniation, with if it's like a kind of partial herniation, then with proper core exercise, the disc can come back into its original position. So unless if it's fully herniated, then it won't go back. But if there's still parts of it attached, there is a chance that with proper exercises and proper treatment, it can go back into its original position. So for the second type, we're going to talk about spinal stenosis. So similar, kind of, it's a different layout as the other one, but similar. This is what a normal kind of level of the vertebral body looks like. And with stenosis, there's like Maya talked about earlier, there's going to be osteoarthritis, and it's going to be kind of like a compression of the disc, as well as the compression of the joints in between each level. So when there's compression between each level, there's going to be more narrow space in between where the nerve is running. So that's what's causing stenosis, when this part in the middle of the spinal canal gets narrowed down and there's less space for the nerve to run through. So it's kind of causing impingement through the bones instead of through the disc. And then the third type is spondylolisthesis, is when over time, especially with like people with osteoporosis, when you're bending or lifting and then there's wear and tear over time, there can be many thin breaks in the bone. And when there's many breaks in the bone, the structure is not as stable. So the vertebra can slip forward, or it can slip backwards or to the side. And when that happens, then it's this condition called spondylolisthesis. And with the slippage, it can also cause impingement on the nerve that also runs along that middle part where there's supposed to be a space. So with this, it's quite common with a fall. If someone had a fall or car accidents, we see that quite often. So when there's like a mini break, and it's quite painful for this condition. So usually in addition to like the nerve, like tingling, numbness, there's also like kind of extreme like sharp pain as well with this type of condition. Okay, and then we'll go into the next one. Let me just,
You could just escape and go to the next.
yeah, we just have to kind of troubleshoot. I'm just going to the next slide.
There we
Okay. And then into the muscles. And then you can talk about the muscles. Am I talking about muscles? Oh, okay, sorry. We're going to talk about, like we talked about the nerve, and then these are kind of the pelvic floor muscles. So this is kind of looking from the pelvis, like from the top down. So we're looking at like the group of pelvic floor muscles. This is kind of where, you know, people might, with low back pain, they might get a bit of incontinence. They might feel like they have to go to the bathroom very often because these muscles are weak. So it's not unable to kind of hold your bladder, because it's like, you know, your bladder sitting on top of these muscles, right? So when, you know, your bladder gets full, these muscles are weak. So you might get kind of the sensation that you have to go use the bathroom very often, or you can't hold it, or sometimes there could be issues of incontinence as well. And then for the low back pain, there's also issues with having the pelvis kind of like rotate forward. So as we, you know, sit in a prolonged position, our pelvis, you know, like because our pelvic floor muscles are weak, our pelvis starts rotating forward. So, you know, you're gonna have a bit of like a hip that kind of goes forward a bit as you're sitting longer and longer when these muscles are weak. So we're going to address these in one of our hacks later. We're going to talk about how to kind of engage our core muscles and our pelvic floor muscles so we can maintain a better posture and position with our hips and pelvis. So oh, sorry, there we go. So with the core muscles that we're also going to talk about, the core muscles are like a deep muscles that are running, I don't know if you can see me. So like, sorry. So they're running like right here, like they're running horizontally, as you can see in this picture. And they're running kind of from the back of your ribs all the way from the back of your back along your ribs to the front. And then they're going, and then they're attached kind of all the way down past your belly button and all the way down towards your groin, towards your pelvis, So these muscles are different than your six-pack muscles, because these muscles are going kind of like a brace around your back. And these are what we call core muscles. So we are also, some of the exercises we're going to go over are going to emphasize engaging these core muscles so you can stabilize your internal belt. So next, we're going to go through and kind of ask people to put in the chat, what kind of symptoms do you normally experience with your low back pain? Just type in the chat, what kind of symptoms do you normally experience? So we'll give you guys a minute to just like, you know, type in the chat, and then we'll read out some of the answers and then go through it as well.
Pinpoint burning sensations.
Okay, so yeah, the burning sensation is a type of nerve sensation. So that means that somewhere along the back, the nerve is being pinched.
Mild ache and fatigue.
Okay.
Spasms. Low back so tight, I can have problems even lifting a leg to put pants on or even wipe myself. Constant aching, sharp pain in low back, radiating down legs, tightness. All very common low back symptoms.
Mm-hmm. Yeah, those are some of the, so we're gonna go on to the next slide.
Excuse me.
So this is kind of like similar to, I think, what some of the participants had mentioned. With the tightness, the pain, the burning. So these are kind of like some of the common symptoms associated with the low back pain that most of you kind of described in the chat. Yeah, and then we also mentioned like trouble sleeping. So some people, when the pain gets so aggravated, it's like any position. If they're lying on one side, it's like they feel kind of like, you know, they might feel some more of the nerve symptoms, and then they have to keep tossing and turning. So their sleep gets quite interrupted. And then also like with that increased pressure with sneezing and coughing, some people, when there's that increased kind of abdominal pressure, when they do those activities, it can cause like more pain, kind of causing more compression in the low back, and especially when there's nerve pain associated with that. Okay, so we are going to go through some tests to check out your low back and see kind of what type of pain you might have. So if everyone can see me, I'm just gonna back up a little. So we're gonna get a little bit of space, and then we're just gonna bend forward and see how that feels. So at any point, if any of the tests is causing a lot of pain, just don't go to that point, just slowly come back up. So if anything is too painful, just kind of stop and just kind of come back up. So that's already a positive test. So if you kind of bend down, keeping your knees straight, see if there's any issues with the low back, and then slowly come back up. So that's the kind of bending forward, and then we're gonna have our hands like that, and then we're gonna bring it back and see if there's any pain. So go like that, and then just okay, good. So those two are just kind of like seeing how you perform actively with these two motions. So just take note of like which test caused you pain. So later on, we're gonna ask you which one of the tests kind of caused pain, and we'll open it up to the chat. So maybe just like jot it down. That was the first one, just bending forward and bending back. The next one, it's called a favor test. So if everyone can find a spot where they can maybe lie down either on the mat or just like on the couch, just like a area where they can lie down, because the next test requires you to lie down. Okay, so we go like this. So we're gonna bring your leg like that. So bend your left leg and then your right leg. You're gonna do a figure 4 and see if that causes any pain to your butt or to your back. You might feel a bit of a stretch. A stretch is okay, but you shouldn't feel pain or any burning or tingling. So hold that for 5 seconds.
So for those that can't see Lily's screen, she's laying on her back. Oh, there we go. That's better. Yeah, just some people are having a hard time seeing you, Lily.
Here, I can take.
Maya can.
I'll give you guys different angles here.
Oh, perfect. Wait, good teamwork. So that's the Faber 4 test.
Yes. Like that. And then do the other side. So that's the Faber 4 test.
Awesome.
And then
Yeah.
Yeah. And then I'm going to do the next one. So I'm going to have my neck down. So this is a straight leg raise test. So you're going to keep your knee straight and try to bring it up as far as you can. And see if it provokes any pain in the low back or any tingling or numbness. See how far you can go. So if you start feeling any tingling or numbness from here to here, just stop Just take note of that. And then we're gonna go do the other side.
So for those that can't see, Lily is just laying on her back and raising one straight leg at a time. And the stationary leg is straight as well.
Yeah, I'm gonna unshare her screen just so you can and go back to Zoom.
Is that better?
Is that here? I'm gonna stop sharing. Here.
Is that better?
How's that? Is everyone seeing a little bit of a bigger screen there?
Is that better, Jenny? Yes. Okay. Thank you very much, Maya. That's perfect.
Yeah, awesome.
Like that. And then we'll do the other side. Do you want me to redo the favorite test again?
Yeah, why don't we just do that quickly?
Yeah, I'll do the favorite test again, the figure 4 one.
Yeah.
Where it's like this one. So making a figure 4 with the right leg over the left thigh, and seeing if there's any kind of pinching, achy symptoms in the low back. And then we're gonna do the other side. Okay, and then we're gonna do the straight leg raise again. So we're gonna bring it up, keeping the knee straight. And if there's any symptoms, just take note of that. If you start feeling any tingling, numbness, shooting pain, then that's part of the nerve. The sciatic nerve test. So that's the nerve that runs the back of the leg.
Yeah, you know pretty quick if you test positive for that one.
Yeah, you'll feel immediately. So
You might yell a bit.
what we're gonna do is lie on your stomach. I'm gonna go like this way.
Okay.
So going on your stomach, and then you're gonna bring your left leg kind of up, and see if you feel any discomfort in your low back.
So it's similar to like a quad stretch. So you grab your ankle.
Can you see it?
Mhm.
Yeah.
We'll go to this side.
Awesome. And the last one?
The last one is called the slump test. So the slump test, you'll be sitting on the chair. You can be on the couch. And then just have your hands behind your back. And then you're going to slouch over. So make a little bit of a slouch. And then you're going to have your right knee straight. And then flex your toes towards your face. See if you have any pain. If so, if you bring your neck up, see if that makes it better. So if you go down, you should feel worse. And when you bring it up, it should feel better. Perfect. Okay. And we'll do the other side. So the other side, we're going to sit back up straight. And then we're going to bring our hands back. We're going to slouch. And then we're going to bring our left knee straight. Flex our toes towards our face. See if that makes your back feel kind of like the leg symptoms or any low back pain. And if so, bring your neck up. And if that makes it feel better, and then just see if it makes it feel worse again. So if you test positive, then you will feel worse when you look down while the toes are pointing towards you, and you'll feel better when you look up. So those are the 5 kind of brief diagnostic tests. We try to decipher what type of back pain you have and what part of the nerve is being pinched. So, yeah, so we are going to present again. So the next one, we're just going to show you. So before we start with the sample patient, can we maybe just put in the chat like who felt any pain with the first test? If you felt pain with the first test, the active range of motion, like the one just bending forward and then bending back, the first test we showed. Can you just type in the chat, the one that when you like go forward, can you type in the chat if you felt any pain going forward or going back? So just type in the chat.
No, it doesn't look like anybody tested positive. Oh, no, here we go. Pain in the first test at the spine, pants level and forward bend. Mild ache bending forward, pain forward, bending forward results in lower back pain. So quite a few actually tested positive for active range of motion.
Yes. So yeah, like having that forward motion, it's kind of causing a bit of more compression into the vertebral body. So if you're feeling kind of pain or achiness, that's quite normal if you're having a decreased space in between the lumbar segments. So for the second one, who tested positive for that figure 4 test where I like had one leg over the other, kind of like a figure 4 stretch? It's the favorite test, the second one that we did.
Oh yeah, Cheryl says she's got pain in the hip and burning on that one. Jenny has pain in Faber 4 as well.
Yeah. So if you're having some issues with Faber 4, then your hip, your pelvis also might be rotated in addition. So that can be causing compression into your low back. So we will talk about that too. So that's like kind of when we talk about the pelvis being like rotated forward, that's part of the diagnostic for that.
Yeah, and very common for one side to hurt and the other one not to hurt as well.
Yeah, that's quite common. It's like asymmetrical between the sides. And then for the third one, our straight leg, like bringing our leg up. And then that's the one that Katie had mentioned that if you have pain, you usually will feel it pretty soon. So the one where we lie down and bringing our leg straight up. Did anyone feel pain with that?
Cramp in mid lower back, burn and tingling in toes, and burn in hip.
Yeah, those are part of the spinal stenosis. So like with the nerve impingement. So those are nerve particular injuries. So yeah, when you're feeling the tingling, the burning, that's when it's the sciatic nerve that's being pinched. So because that nerve runs all the way from your back, all the way down your leg. So that's why you're feeling the symptoms all along the muscles of the back of the leg.
Yeah, there was some that was very painful for, and some it hurt halfway up the spine as well.
Mm-hmm. That's a very, very provocative test. So it's a very useful test to figure out if it's sciatic nerve or not. So that's one of the more provocative tests. How about for the fourth one, the kind of lying on the stomach and then bending your knee back, kind of like a quad stretch. Did anyone have pain with that? Because that's a different nerve compared to that straight leg one. Anybody had any issues with that one? That one is usually way less common. So usually out of every like 10 patients, I would see 9 with like, when they have nerve pain, it's like usually 9 of them will have sciatic nerve and then 1 of them will have that front part of the nerve.
I think Cheryl did. I think she said cramp in mid lower back at arch point.
Okay, so Cheryl, do you also have pain with the one previously, the raising the leg?
She did, yes.
So that case, so you seem like you have both the sciatic nerve and the femoral nerve. So they're both like one of the nerve goes to the front of the thigh, one of the nerve goes to the back. It seems like you might have compression on multiple levels, causing the nerves on the different levels to be pinched, causing the symptoms to be positive on both tests. And then the last one, the slump test. Who presented positive with that one?
Yeah, we've got Cheryl again, tightness at base of neck in forward slump only. And Lori also tested positive for that as well.
Okay, so
him.
Yeah, so that's also the second test for the sciatic nerve test. So that test when we raise your leg up, if you have both positive and the leg raising and this one, then most definitely you have like sciatic nerve compression. So that's a second definitive test for your like sciatic nerve.
And Jenny also had weakness in her leg when she was trying to lift it.
Okay, so yeah, so Jenny, you have like the nerve symptoms with like it being affecting your muscles as well. So it's kind of like the second stage. So it's a little bit more of an advanced stage. So when you have both the weakness and like, you don't have just the tingling, then that's kind of like the second phase. So the nerve is quite irritated from the sounds of it. So we're going to go over a sample patient that we did some of the tests for. So we're going to show a sample patient. Click on that. Let me know if you guys have any, there should be sounds to that. So he's doing the forward bend test. He's having some of that nerve issues too.
And then
So
let's
he's
come up straight again. And then let's put your hips behind, put your hands on your hips and just bend backwards. Any discomfort there? No? Okay, sure. And then let's get you lying down on your back. And you go bend both knees. So bend both knees, and you go do a figure 4 with your right leg over your left. Any problems there?
Yeah, so he's saying he's having issues with the back of his buttock.
How's that feel? Okay, and then let's straighten out both your knees. And then, yeah, both legs straight. And then let's try to bring your right leg up. Keep your knees straight. Let us know if you have any symptoms. Kind of towards your right hamstrings again. Is it like sore or tingling?
Yeah, more of it.
Tingle. Okay, let's do the other side.
So just to say, he said he felt a tingle down his right leg.
Try to keep your knees straight. Problems there?
No.
Okay, good. And then let's get you on your stomach.
This is a stomach test.
Okay. Let's bring your knees behind you. Yep, towards your bone. Anything there?
No.
And then, okay, and then the other side. Oh, okay, good. And then we'll do the last test. So you just need a chair. You can sit on the chair. Yeah, just sit up straight, and then hands behind the back, and then start slouching over, like you're really slouch. And then let's straighten out your right knee. So kind of, and then have your leg out straight, and then off the floor. Yep, and then flex your toes towards your face. Problems there?
Yeah.
Okay, feel it down the back of your leg, right leg. And then let's do we sit up straight again. Okay, and then put your legs down. And let's do the other, and then just slouch again. So slouch, and then left knee straight, and then bring it up off the mat. Good, and then flex your toes towards your face.
Okay, good.
How's that?
Better.
Better?
Oh, so yeah, so the patient, to summarize, like he said, like for 3 out of the 5 tests, he was having that tingling going down to his right, kind of right buttock, right down to like down his hamstrings, his right side. So we are excited to show you kind of top 3 exercises for your low back pain. So I know we've aggravated you, so we're gonna do some exercise to kind of calm that down. So the first one is activating your core. So we're going to stop sharing, and so you can see us in bigger screen. And then I'm going to demonstrate. So if everyone can find a space lying down, you could be on the mat, on the floor. So you're going to have your knees bent, and we're going to try to get that like pelvic floor and that core muscles we talked about earlier. So you can have your hand where the pointy part of your hip is, index finger, and then go 1 inch in, 1 inch down. It's better to feel on skin, but you can try to feel it on top of clothes, but I prefer having it on skin when patients are doing it. So they can, these hands are just to like feel what you're, when you start contracting that core. So what you want to imagine is just kind of like putting on a pair of tight jeans, and you're like zipping up, so you're kind of cinching in here. So you're zipping up, imagining that, putting on that pair of tight jeans, and you're kind of like bringing your pelvis down, and you're keeping that tight. And then holding your bladder as well. So kind of holding your bladder, engaging the pelvic floor muscles, and like imagine this part going together. So you're putting on a pair of tight jeans and you kind of have to like bring your stomach in together.
So just pretend you're back in the 1980s.
Yeah, drawing your belly button down towards your spine. So holding that for 10 seconds. And then once you're finished holding 10 seconds, you relax. You should feel a little bit of activation in underneath your fingers. So we'll do that 2 times. So we'll hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Hold again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then relax. And then the next exercise is called a heel slide. So it's like similar. So it's a progression of that first one. So you're, holding that again. So engaging, like putting on a pair of tight jeans, holding your bladder, and then you're gonna slide your heel this time. So engaging the leg. So you're gonna do it slowly. 1, 2, 3, 4, 5. Keep holding. 6, 7, 8, 9, 10. Again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's the second exercise. You'll do 5 on each side. So with the first one, you'll do 5 of that. And the second one, you'll do 5 on each leg. And then the third exercise, it's called a crab walk. So we're going to go like this. So we're standing. We're going to also get that core again. So tighten up. And then what you're going to do is you're going to bend a little, squat a little, and you're going to go out. And you go slow, go sideways. So sideways stepping while squatting, while holding the core. Doing 5 steps one way, and then 5 steps the other way. So nice and slow, holding everything nice and tight. So 5 steps. So you would do 3 times of each direction. So 3 times of going one way, and then 3 times of going the other way. Okay, so you should practice those kind of in that order, those 3 exercises. And then, like you should feel over time at the beginning, you might not feel like the core is like, doing much, but over time, your core, it does take 6 to 8 weeks for you to kind of get a stronger core. So, little by little, it's just that mind-body connection, trying to connect your brain to kind of feel what the core is. And at the beginning, the core might be weaker, you might not feel much, but that's quite normal. So just keep working on that. Just try to engage, feel that deeper muscle, kind of holding your bladder, having that, bringing that belly button towards your spine, and just like practicing that often, like, 2 times a day, when you're sitting, when you're standing, and when you're lying down is the easiest because you don't have any gravity. So try practicing those kind of 3 exercises that we talked about, and it should basically get that internal core muscle stronger so it can protect your back, so it can relieve that pressure off the nerve.
Lily, there's 2 questions on that. The first question is from Glennie. She said, in the first exercise, what is the position of the pelvis?
The position of the pelvis is neutral. So you don't want it. So you're just kind of laying there, and you're just kind of keeping your pelvis as neutral as you can. So you're not tipping it forward or back. You're just kind of keeping it wherever your neutral is.
Okay, and then Susan wants to know, what position were your feet in the last exercise, in the crab walk?
Oh, the crab walk? I was just pointing forward so that you can see me. So I'm just kind of going like that. So my feet is just like, can you see my feet?
Yep.
Like facing forward. So then as I'm going like that. So my feet is just pointing towards pointing forward.
Perfect. Thanks, Lily.
No worries. Okay, and then we'll go on to the next. And then,
Do you want to ask them if there's any difference?
yeah. With after the participants did some of the exercise, did anyone feel any difference in terms of like because we know we did flare people up during some of the provocative tests earlier. Did anyone feel any different sensation after they tried a few of the exercises, or not quite yet? Because we only did like 1 or 2 of each. Type it in the chat.
And you were saying that with these exercises, it can take several weeks
Yes.
to realize the benefit of it.
Yes. So usually with the low back exercise, it's not as quick acting as shoulder or shoulder exercises, because with the low back, there's a lot more kind of muscles, and it needs a lot more repetitions in order to build that endurance. So you likely won't feel immediate changes from these exercises, but kind of even after a week or 2 weeks, you will notice like kind of minor changes. And then as time goes on, the difference will be bigger and bigger.
And Lori said that she is calmer feeling in her back now. So that's great.
That's good. Yeah, that's awesome. Yeah, that's kind of like, having that sensory feedback to the back. So like the core is kind of stable. Like doing, giving that neural feedback to the brain. So that's good.
So be patient, everybody.
Yes.
Mm-hmm. Okay, so I have a really quick little part on the importance of posture. So basically, because our spine is in the middle of the body, it supports the body. It's so important to practice proper posture to have good spinal health. So posture is usually a result of the habits throughout years, which can be either good or bad, but it's really beneficial to change those habits so that they benefit you and your spinal health. So the back, like we can see in the diagram, has a natural S curve. So ideally, like the green diagram, you have a little bit of an inwards curve near the bottom. And
I don't think everybody's seen the slide, Maya.
Oh, we shared right now. 1 second. Oh, I don't think we're shared. Sorry.
That's okay.
Yeah. Okay, here we go. Now you can see the slide. But basically I was saying with the green diagram, that's ideal where everything is stacked on top of each other, where there's multiple diagnoses that can go along with in the pink diagrams, like lordosis is the leftist of the pink, where that natural S curve of the body is interrupted. So the bottom, like the buttocks is facing outwards, and that's the pelvis is posteriorly rotated, not ideal for how you want to sit. And then another really common diagnosis for spinal injury or spinal curve disorder is the very right, which is called scoliosis, where your spine is improperly aligned. So there's a little bit of a shape to the right that you can see here. But I had a quick little activity just because I know a lot of people are working from home, especially right now in this time. And I thought I would take some time to address proper posture when sitting at the computer or whatever you may be doing. But I know a lot of us are spending a lot of time sitting and being inactive right now. But just some quick tips where your eyes should be level to the top of the computer. With a laptop, it can be more difficult, but it's easier to address when you're sitting. Your shoulders should always be relaxed. You should never be typing like this. You always want your shoulders to be relaxed and having a long neck the entire time. When your arms are out, you should always have a slight bend in your elbow, and the computer should always be close enough that you have a slight bend and you're relaxed in your shoulders, chest, and arms. You should always have a straight upper back. So you shouldn't always have like a curved upper back, and that's really common to have anteriorly rotated or forward rotating shoulders, and that can be really poor later on because that's really common to slump when you sit. And then lastly, your feet should always be touching the ground. So a really quick tip for me, I'm quite short, so I always put a stool underneath my desk so that my feet can rest on it. And making sure that your feet are pressed firmly against the ground is really, really important, because usually when you have that support on the ground, it stops you from slumping. So it's really, really good to have a good desk chair, good posture, and practicing that for good spinal health. Yeah.
Awesome. Thanks, Maya. That was a good reminder. I realized how poorly I was sitting there watching this. So that was good. So one of the things that I've learned in my many years of being a registered massage therapist is to look at the body through a somatic lens. And somatics, it's basically very gentle movements to unlearn stress responses that happen in the body. And these stress responses can happen if we have got repetitive strain, if we have an injury, it could be unconscious positioning that we're not even aware of. And so looking at this through a somatic lens, the image on the right the green guy, we call that the green light reflex. And so what happens is all the back muscles get really, really tight. So the back is arched and the shoulders are drawn back, kind of like a military posture. And the personality associated with this posture is often A-type. So they're super busy, they're always turned on, and they're very, very active and quite intense. The opposite to the green light is the red light. And this is the diagram on the left that is colored red. And so this one involves the front muscles of the body. So the shoulders become rounded, the back is slumped, and the chin is jutted forward. And this can actually be caused because of stress and anxiety. They go into that fear response, but it also can be from postural or repetitive from sitting at a desk or driving long hours. And oftentimes when people are stuck in this red light reflex, they are having difficulty breathing and taking deep breaths. And so we will often see lack of oxygen issues. So people can become quite fatigued. They can also have depression, anxiety, and a difficult sleeping. And then the third reflex that we see is the trauma reflex. And this is all those trunk rotators. And it is often an involuntary response to accidents and injuries, but it also can be caused from habitual standing on one leg, or if we are avid golfers, or even carrying your child on the same hip all the time, we can get into this stress response. And with this one, we'll often see scoliosis happening. So why does this happen? It happens because of sensory motor amnesia. And if you just want to go to the next slide, you can, we'll just have a quick slide on the sensory motor amnesia. So basically what happens is the brain and the muscles stop working together. And the only way to correct this is through active movement of somatics. And I'm a huge fan of somatics. It took me out of 20 years of chronic neck pain from multiple motor vehicle accidents, compounded by a career of being a driver and then going to school for over 2 years and sitting and being stressed out. So there is hope for people that are stuck in these reflex patterns to come out of these patterns, to regain their mobility, to come out of pain, and also to walk and feel younger from just doing these movements. So we actually have a couple of bonuses to offer you for attending tonight. And the first bonus is a complimentary somatic class to learn somatic movements for eliminating lower back pain. The class is on Friday at 10 a.m. and you can register online. It will be 30 minutes long. So if you go to CourtneyMassageTherapy.com, you can register, and I'd love to see you there. It'll be an interactive class again where you can ask questions and give feedback. And it's remarkable how quickly people can change their posture and come out of pain. So hopefully I'll see you on that Zoom. And then the second bonus is give our physio hotline a call in the next 7 days, and you can arrange to have a free assessment and video treatment with Lily. So that phone number is 250-897-0069, which opens us up to questions. And I know Cheryl had a question from the very beginning. There was 2 emailed in. So where is that question gone here? So this is a question. It says, I have stage 4 deep infiltrating endometriosis. My organs are fused together and to my pelvic wall. What can I do to address chronic pain in my lower back until I get surgery?
Okay, so So when that happens, that means that the pelvic floor muscles are grabbing on, so it's super tight. So like doing these exercise, and the key thing is kind of like the first exercise that we talked about, having that core activation, and then really focusing on completely relaxing it between each set. So focusing on activating, and then that full kind of release of all the tension in that muscle. So like practicing that 10 times, and that kind of on and off, like knowing how to turn it off. That's a key thing to also kind of down train that pelvic floor muscle. So that's a good one. And then similar to all the other two exercises we talked about, like for you, like the individualization is really focus on completely relaxing all the muscles in between each repetition.
Yeah. Yeah. And I would also suggest, Cheryl, jump on that somatic class on Friday, because we do a lot of the contraction and then the complete relaxation to retrain the brain to let those muscles let go. Yeah. And then the next question is from Tom, and he says, recently I could feel my bone crack while doing lower back stretching exercises, particularly when I do the knee to chest back curl and cat curl exercises. It will crack only once during the whole period of stretching exercises, and it will not reoccur. When the bone cracks, I hear the sound similar to knuckle cracking. I do the exercise once every day for the past 2 years. The bone cracking will happen every day since 4 weeks back. Why does this happen, and are there any concerns?
Okay, so usually if there is no pain, no kind of tingling, no numbness, no like aggravating factors, you just hear the bone crack, it shouldn't be a concern. It just means that somehow there's like pressure built up inside the joint. So when you're doing the exercise, it's causing a release of that pressure. It's like kind of like gas releasing. So it's just like kind of mini gas bubbles in between the joints. So as long as there's no pain or discomfort, it should be fine. And then Katie, do you have anything to add to that?
Yeah, I would say as long as there's no pain or extra or like inflammation on that, I would continue doing it. It's very common for people to have crepitus in their joints. And so it sounds alarming, but if there's no pain or inflammation, it's usually not. So
Okay.
if you do have pain, I would definitely follow that up and talk to book a call with Lily, and she can talk more about that with you.
Mm-hmm. Yeah, and then if that doesn't, if you're concerned, then just give us a call. And then we have another question that says from Jenny, asking if there's any good exercises to do before bed to ease the back pain during sleep. So the first two exercises that we talked about, just kind of like getting the core waken up and doing like 5 to 10 repetitions of that. That's a really good exercise kind of right before bedtime, because it's training the muscle to giving it that feedback right before sleep. So then when you're sleeping, the core muscles kind of got woken up, and it's like hopefully it's kind of gets that stability even when you're sleeping, especially if you're tossing and turning. It's a good one to kind of wake up the muscle before you go to bed. And that heel slide is kind of like moving and stabilizing your legs right before bedtime. So that's also like a good stability exercise to do before sleep, because you're lying in bed anyway, so you're like lying down, so it's like easy. You do 10 of each and then you go to bed. It helps a bit with managing that pain signal and pain management.
And we have another question from Susan. She says she has muscle spasticity, especially in her legs. Do I have to do anything differently for maximum effect?
So no, when you have that spasticity, it's because of the nerve kind of being irritated. So with the exercises that we did, I would say if you start feeling like because then the exercise is trying to stabilize the core, so it's trying to kind of control that pressure off the nerve. So as long as the exercise doesn't cause an increase in the spasticity, then you don't have to do anything different. With the spasticity, you just have to kind of monitor it. So if anything starts aggravating it, like kind of squatting on it or standing on it for too long, then you have to do less repetitions of what we've prescribed. So with spasm, you just Usually with the repetitions, you might have to go a little bit less for the standing one, the third one that we showed you. But for the first two, you should be fine.
Awesome. Thanks, Lily. Is there any other questions? We did go a little bit over time today, so we apologize for keeping you over the hour. Definitely worth the information though. So if there is no other questions, we will thank you once again for joining us, and definitely encourage you to take advantage of the bonuses, and definitely give us a call. We'll book you in for a free assessment and treatment with Lily, and we'll also get you in on a somatics class, particularly for low back, to give you some more tools to manage your pain, improve your mobility, reduce your stress, and get your life back.
Yes, we're excited to hear from you. So do take advantage of the bonuses so we can kind of do a more individualized assessment and treatment for you.
Awesome. Thank you so much, Lily and Maya, for joining me on this class. It's always so much fun to work with you ladies, and I really appreciate you spending your time with me tonight. Thank you so much, and thanks again to everybody for showing up. Take good care, enjoy yourself, and be safe and happy, and we'll see you soon.
Yes, thank you everyone.
Bye.
Bye.
Bye.